Since the beginning of history, human beings have struggled with cancer. Some of the earliest evidence of the disease has been found in fossilized bone tumors and human mummies in ancient Egypt. The oldest written description of cancer dates back to 3000 BC. The writing describes the disease as untreatable. Today, we have discovered treatments for cancer. Scientists have learned more about the disease in the past 2 decades than they ever have before. But the disease is still the second leading cause of death in the U.S. It's estimated that 1.6 million Americans will be diagnosed, and about 570,000 will die of cancer this year. At the National Cancer Institute in Bethesda, Maryland, researchers work every day to learn more about the disease. As they work, Dr. Cronin tracks our progress as a nation. She works in the Surveillance Epidemiology and End Results Program, better known as SEER. The department has been tracking numbers related to cancer since 1973.
I think it's very important if we want to understand how our interventions in the public are actually translating into reduced cases and reduced deaths. We have to be able to track it.
In order to see how we're doing now in the fight against cancer, let's go back to the year 1975. In that year, for every 100,000 people in the U.S., there were 400 new cases of cancer. According to the most recent numbers, for every 100,000 people in the U.S., there are 461 new cases diagnosed. Although the incidence rate is higher than it was in 1975, Dr. Cronin says this is largely due to earlier diagnosis and an older population.
One thing that's sort of important to note is that as the population changes, as it gets older, you might get more cancer cases, even if the rates are going down.
She says the incidence rate has actually been declining since it peaked in 1992, with 510 new cases of cancer for every 100,000 people. According to the SEER program, cancer death rates have also been dropping since the early 90s.
Generally, there's changes in risk factors in the population, and there's early detection, that's screening, that's identifying cases earlier before they progress. And there's also advances in treatment over the last several years, all of which are pushing mortality rates down. If you compare the mortality that you would have seen if mortality rates had remained at the level that they were in the 90s compared to the decline that we've seen, over 700,000 deaths were averted for men and almost 300,000 deaths were averted for women.
While we've made progress as a nation in the fight against cancer, much is left to be learned about the disease. In the coming years, researchers at the National Cancer Institute will continue working to fully understand the molecular basis of cancer, in the hopes that they can take that understanding and turn it into new ways to prevent, diagnose, treat, and screen for this deadly disease. For Smart Talk, I'm Kira McGuire.